Breast, normal cells. Ductal cells form small, cohesive, orderly sheets. May have slight crowding. Nuclei are round to oval, with smooth nuclear membranes, fine chromatin, small nucleoli. Cytoplasm usually scant or delicate, may have apocrine change. Foamy histiocytes may have pigments or inclusions. Myoepithelial cells often shed cytoplasm on FNA, oval bipolar nuclei. Apocrine cells form sheets or single cells. Nuclei usually uniform, can vary in size and shape. Smooth nuclear membranes, fine chromatin, nucleoli often prominent, finely granular cytoplasm, often have reactive changes. Breast insufficient or inadequate. Smears too sparsely cellular, or too poorly smeared, or too poorly fixed to allow a diagnosis. Anything atypical is never insufficient or inadequate. If a solid mass lesion is seen on imaging, around 6 to 7 epithelial cell groups with 10 to 20 cells are required. Breast benign. Acute mastitis or breast abscess. Neutrophils in proteinaceous background. Histiocytes. Myxoid granulation tissue with branched capillaries. Bacteria in Giemsa stain. Sheets of inflamed ductal or apocrine cells with low NC ratio and uniform increase in nuclear size. Uniform chromatin, even with hyperchromasia and prominent nucleoli. Recurrent subareolar abscesses known as Zuxka's disease. Pus, keratin debris, superficial squamous cells may be reactive. Red painful swelling clinically. Breast benign, granulomatous mastitis, seen in tuberculosis or silicone reaction. Multinucleated giant cells, histiocytes, epithelioid granulomas, lymphocytes, proteinaceous background, mildly atypical ductal fragments. Silicone may be seen in histiocytes or giant cells with foamy cytoplasm containing faintly refractile, non-birefringent globules. Breast benign, fat necrosis. Multicolored, coarsely granular necrotic debris. Sometimes infarcted, anucleate necrotic fat fragments. Small amount of macrophages or giant histiocytes. Few to no epithelial cells. If large amount of multinucleated histiocytes with bubbly vacuolated cytoplasm are seen, consider reaction to silicone. Breast benign, normal breast tissue FNA. Low cellularity. Small cohesive terminal ductular tissue fragments of relatively uniform epithelial cells with myoepithelial cells. May have intact lobules in a clean background. Small amount of naked bipolar nuclei. Myoepithelial cells on a different plane, nicknamed sesame seeds on a bun. Breast benign cyst. Thin to thick proteinaceous background. May have crystals or debris. Foamy histiocytes, multinucleated histiocytes, hemosiderin-laden macrophages in varying amounts, may be single or in aggregates. Single cells or sheets of apocrine cells. Cyst contents diagnosis. No apocrine cells, correlated clinically with no palpable residual mass. The other diagnosis is cyst with apocrine cells. Breast benign, fibrocystic change. Large and small cohesive ductal tissue fragments, apocrine sheets, foamy histiocytes in a proteinaceous background. Breast benign, epithelial hyperplasia. Moderate to highly cellular. Many large epithelial tissue fragments, some small cohesive fragments with bland nuclei. Myoepithelial cells on the tissue fragments, naked bipolar nuclei in background. Larger three-dimensional groups with irregularly arranged cells, nuclei that lack orientation, stream around slit-like secondary lumina, show variable mild nuclear enlargement and pleomorphism with many myoepithelial cells. May have dispersed single epithelial cells, especially at the tail of smears. Breast benign fibroadenoma. Medium to high cellularity smears with cohesive, often branched, antler-shaped epithelial cell fragments with myoepithelial nuclei layered over top. Fibrillary to rounded, scalloped fibromyxoid stromal fragments. Naked bipolar nuclei in background. Single epithelial cells sometimes on the tail of slide. May have mild nuclear enlargement, anisonucleosis, crowding, prominent nucleoli, often found in younger patients. Breast benign, intraductal papilloma, medium to high cellularity, mostly large, cohesive ductal tissue fragments, some small tissue fragments with myoepithelial cells, together with papillary stellate or complex fragments with fibroelastic stromal cores. Proteinaceous background with apocrine epithelial cell sheets, siderophages, histiocytes. Three-dimensional sheets often have irregular slit-like lumina. Apocrine sheets or focal apocrine change are often present. Breast benign, lactational change. Variably cellular. Small epithelial sheets of cells with microvaculated cytoplasm, mildly enlarged round nuclei with small nucleolus. Milky background of fat globules, thin proteinaceous material. Isolated intact acinar cells. Round stripped nuclei with nucleolus. Breast benign, adenosis or sclerosing adenosis. Moderate to high cellularity. Small cohesive ductal tissue fragments with myoepithelial nuclei associated with small dense stromal tissue fragments. Bare bipolar nuclei. Scattered single epithelial cells in background. Breast benign, gynecomastia. Often low cellularity. Hyperplastic ductal epithelial tissue fragments with myoepithelial cells, bare bipolar nuclei, and some fibrillary stromal fragments. Breast benign, intramammary lymph nodes. Polymorphous population of lymphocytes with small lymphocytes predominating. Possible germinal center material. Breast atypical, low-grade or borderline Phyllodes tumor, aka leaf tumor. High cellularity, large epithelial fragments of ductal cells with myoepithelial cells, and may have apocrine or squamous metaplasia. Usually prominent large hypercellular stromal fragments with varying atypia, nuclear enlargement, irregular nuclear membranes, may have bent nuclei, irregular mild hyperchromasia, more prominent nucleoli, may have mitoses. Naked bipolar nuclei, degenerated cells, stripped nuclei, increase in background stromal cells. No necrosis or heterologous elements. Rapid growth is a red flag for atypical or higher diagnosis. Breast atypical adenomyoepithelioma. Moderate to high cellularity, mix of small and large tissue fragments. May have small fragments of fibrillary myxoid material and bare bipolar nuclei. Large fragments are a mix of crowded cuboidal epithelium with uniform round nuclei, surrounded by prominent spindled myoepithelial cells with clear to pale cytoplasm, round to oval nuclei, which spin off tissue and merge with less cellular stroma. Smaller tissue fragments of spindle cells can be hypercellular and myxoid, or sclerotic and tufted. May have metachromatic round collagen globules. Naked bipolar nuclei, foamy histiocytes, and may have apocrine cells in the background. Breast atypical fibromatosis. Variable cellularity, often low. Small stromal fragments of spindle cells in parallel or irregular arrangement. Some single slender spindle cells in clean background. Spindle stromal cells have oval nuclei, uniform fine chromatin, mild cell pleomorphism, small to inconspicuous nucleoli, low NC ratio, thin tapered pale cytoplasm, light blue in tissue fragments separated by magenta collagen stroma in Gamza stain. May have lymphocytes, stromal tufts, or ductal cells. No or scant necrosis. Can be caused by trauma or familial adenomatous polyposis. Breast suspicious low-grade ductal carcinoma in situ, DCIS. Variable to high cellularity, large three-dimensional epithelial fragments with some discohesive smaller fragments, often many single cells. Epithelial fragments are solid, cribriform, meaning uniform punched out holes, micropapillary or papillary, which is branching and true fibrovascular core. Patterns often mixed, can have columnar cells on edge. Low-grade DCIS, regular honeycomb with minimally enlarged or atypical nuclei. Intermediate DCIS, more enlarged or pleomorphic nuclei. No or few myoepithelial cells or naked bipolar nuclei. Dispersed cells with varying enlargement or pleomorphism, up to less than 2 times red blood cell diameters. Granular or fragmented calcifications. May have histiocytes or hemocytorophages in a proteinaceous background. Breast malignant invasive carcinoma of no special type, NST. High cellularity, large three-dimensional groups, but less in high grade, smaller fragments, and dispersed single cells. Cohesive to discohesive tissue fragments with crowding or nuclear overlapping to loss of orientation. Monotonous to mildly enlarged single cells to large or pleomorphic cells. Nuclei monotonous, round to pleomorphic, mild to marked enlargement, mild to moderate hyperchromasia, small to highly abnormal nucleoli, and may have coarse chromatin or clearing. May have nuclear debris in tissue fragments, sclerotic stromal tufts, tufts with carcinoma, and intercytoplasmic lumens. No myoepithelial cells or naked bipolar nuclei. Low-grade fragments can be tubular or cribriform. Breast malignant, high-grade DCIS. Variable to abundant cellularity, usually with necrosis. Small to large, solid or cribriform tissue fragments. Variable single pleomorphic epithelial cells or stripped nuclei. Large atypical hypochromatic nuclei, large irregular nucleoli, often with perinucleolar chromatin clearing. Variable broken glass calcifications. No or scant myoepithelial cells or naked bipolar nuclei. May have apocrine differentiation. Breast malignant, invasive lobular carcinoma. Low to variable cellularity, highly dispersed single cells with linear strands. May have some small discohesive tissue groups. Single cells are uniform with small to intermediate size, scant to moderate cytoplasm, and NC ratio varies. Mild to moderate nuclear pleomorphism, round to irregular polyhedral nuclei, bland chromatin, and inconspicuous nucleoli. Eccentric or plasmacytoid cytoplasm, intracytoplasmic lumens, which may look signet ring. Single cells or strands may infiltrate sclerotic stromal fragments. Breast malignant, tubular carcinoma, moderate to high cellularity, small, rigid, angulated or comma-shaped narrow cohesive tubules, occasional monolayer or three-dimensional cribriform tissue fragments, and no myoepithelial cells. Variable number of dispersed atypical epithelial cells, mildly irregular nuclei, small indentations or grooves, mild hyperchromasia, single small nucleoli. May have sclerotic stromal tufts. No or scant naked bipolar nuclei. Breast malignant, carcinoma with medullary features. High cellularity. Small syncytial sheets of large epithelial cells often infiltrated by lymphocytes and some single cells. Large tumor cells with high NC ratio, pale cytoplasm, large pleomorphic nuclei, coarse chromatin, perinucleolar clearing, and macronucleoli. Can have many mitoses. Stripped bizarre nuclei. Many lymphocytes may have plasma cells, cellular debris, and lymphoglandular bodies in background. Breast malignant, mucinous carcinoma, variable to high cellularity, variable size tissue groups in a mucous background. Epithelial tissue is balled up, rounded, cribriform, papillary, or tubular. Mild to moderate nuclear atypia and enlargement. May have intracytoplasmic vacuoles or signet rings. Nuclei sometimes have high-grade features. May have branching capillary tissue fragments or calcifications. No myoepithelial cells or naked bipolar nuclei. Breast malignant, invasive micropapillary carcinoma. Moderate to high cellularity, small tissue fragments and single cells. Large atypical hyperchromatic nuclei, prominent nucleoli, moderate to high NC ratio, may have apocrine or eccentric columnar cytoplasm. May have mucin on the edge of tissue fragments or in the background. May have necrosis or calcifications. Breast malignant metaplastic carcinomas, moderate to high cellularity and different patterns. Poorly differentiated carcinoma, small discohesive tissue fragments and dispersal. Or squamous cell carcinoma in sheets or tissue fragments with a background of keratin debris. Or low-grade adenosquamous carcinoma with small glands or tubules and prominent spindle cell component. Or sarcomatous plump spindle cells with dispersed or small fragments. Or fibroblastic fibromatosis-like spindle cells or chondroid sarcomatous stroma. May have necrosis, neutrophils, histiocytes, hemosiderophages, and debris. Breast malignant secretory carcinoma. Cellularity is moderate to high. Cohesive or loose sheets or small tissue fragments. Round to polygonal epithelial cells, prominent intracytoplasmic vacuoles, may have abundant granular cytoplasm. Intensely staining, bubbly secretory material in background. Round nuclei, fine to coarse chromatin, mild atypia with small nucleoli. May have signet ring, plasmacytoid cells, striped nuclei with mild atypia. Breast malignant Glycogen-Rich clear cell carcinoma, moderate to high cellularity. Small, loosely cohesive syncytial sheets and single cells in a finely granular tigroid background. Granular, variably cleared, often eccentric to plasmacytoid cytoplasm, well-defined membranes. Moderate to marked nuclear pleomorphism. May have coilocyte-like cells. Breast malignant adenoid cystic carcinoma. Moderate cellularity, small to large epithelial sheets or 3D fragments, often contain rounded stromal globules, many single cells and strip cells. Globules are magenta in gamza and grayish-green in pap stain. Basaloid epithelial cells with poorly defined scanty cytoplasm, mildly enlarged or rounded or mildly pleomorphic nuclei, coarse chromatin, and small nucleoli. Stripped oval epithelial nuclei resembling bare bipolar nuclei may be prominent in the background. Breast malignant carcinomas with apocrine differentiation. Moderate to high cellularity. Dispersed single cells, many crowded, small or discohesive tissue groups. Large pleomorphic cells with granular, well-defined cytoplasm resembling apocrine metaplasia, large pleomorphic nuclei, hyperchromatic coarse chromatin, perinucleolar clearing, often single or spiculated large nucleoli. May have necrosis and calcifications. Breast malignant, other malignancies. Neuroendocrine carcinoma. There can be well-differentiated or poorly differentiated, aka small cell carcinoma. Non-Hodgkin's lymphoma is less than 0.5% of primary breast tumors. Diffuse large B-cell is the most common. Angiosarcoma is rare. It's the most common primary breast sarcoma. Can occur many years after radiation therapy. Cellularity is low to high, with small, loosely cohesive fragments containing capillary-like structures and a bloody background. Single spindle sarcomatous or rounded epithelial cells with marked nuclear atypia, hyperchromasia, folds, and 1 to 2 nucleoli. May have cytoplasmic hemosiderin or vacuoles. Breast malignant metastases. These are rare in 0.5 to 5% of FNAs. The other breast is the most common primary in females. In the pediatric population, rhabdomyosarcoma and lymphoma are the most common primaries. Most common overall are melanoma, lymphoma, female genital tract, lung, and rhabdomyosarcoma. Prostate is the most common primary site in males. Breast malignant, Paget's disease of nipple. Loosely cohesive minute tissue fragments and single cells with large pleomorphic nuclei, coarse chromatin, prominent nucleoli, abundant cytoplasm with variable density. May have inflammatory cells, necrotic debris, squamous cells, keratinaceous debris. Sometimes the atypical cells are scanty.